everyone, we are live. This is Nurses Week Kickoff. Thank you so much. It is our very first event. We have an amazing jam-packed week for every single nurse in our community, whether you are just starting nursing school, whether you are in nursing school, and whether you are transitioned onto the unit, you have passed NCLEX. So today is going to be an amazing event. We have our special guest host with us, Grand Canyon University, who will be joining us in just a few moments. But we are actually getting started with our Quick Facts quiz. And because this is Nurses Week, we have, again, something that we will be doing every single day. I'll talk a little bit more about it later. But you want to know as well that during this special event, yes, the virtual trainer is getting discounted. We're doing 20% off. Plus, get this, we are doing free worldwide shipping. So anywhere on the planet, your virtual trainer will be delivered to you for free. And you just need to use the promo code REBARnurse.com. Hey, tell me where you're from. We are doing this global event, and I want to know what countries do we have representing. So just really quickly, while I get started with our Quick Facts quiz, if you have your Quick Facts, get it out. This is the time that you will be testing your knowledge of this book. And so I want to see lots of comments on the screen. This actually will be getting us ready for our game night. So the fastest comments, remember with game night, the fastest comments that are correct gets the points first. So we got Texas in the house. Welcome, everybody. We got Texas in the house. We got Haiti as well. So Columbus, Ohio, it's a pleasure to have you here. We're going to get started with our Quick Facts quiz. Again, this is Nurses Week, and we are excited for the kickoff event happening right now. Actually, I see our special guest with us, and I just want to make sure that I'm able to hear her and see her. So I'm going to bring her up on the screen. And you guys know Lauren. I want everybody to say hi to Lauren right now. Hi, Lauren.
Hey, Regina. Welcome, everybody. Hello, REBAR nurses.
Oh, Lauren, I am so happy to see you today as well. I can hear you fine. So I'm just going to start the Quick Facts quiz, and then I'll bring you back on so you and I can chat about what Grand Canyon University has for our REBAR nurses during Nurses Week. So this is amazing.
Sounds great. Enjoy, everybody, and look forward to seeing you soon.
Okay, so here is our first question. Everybody saying hi, Lauren. Ghana in the house. Okay, fastest answers. We're just going to do a couple questions just to get your brain warmed up. This is question number 1. What is inflammation of the lungs called? What is inflammation of the lungs called? And again, this is Quick Facts. This is straight out of Quick Facts. So inflammation of the lungs, put your comments on the screen. And what I'm excited about game night that's coming up on Tuesdays, that we're giving cash prizes away. So I'm thinking maybe today we should be giving some cash prizes away. So if you are answering correctly, you might get a spotted comment, and then that means you may be getting some money from me today. So inflammation of the lungs, does anybody have it? Claire has it. I see it first. She has pneumonia. Yes, that's what I was looking for. Okay, question number 2, guys. I want to see lots of comments on the screen. The more comments, the better. All right, the next question is, what is another name for crackles? And this is in your Quick Facts book on page. What is another name for crackles? And it was just confirmed by Team REBAR. We will be giving out some cash prizes on today. So I want to see it. Dinah has the answer first. She put rails. Amazing. Dinah representing Facebook. We got Facebook. We got YouTube here. Let's go. The third question is this. What does the abbreviation PRN stand for? PRN. What does that abbreviation stand for? You guys are answering in real time. I'm so excited. We have almost 200 nurses right now on our lives. That is phenomenal. I bet you this is the biggest Facebook, YouTube nursing study group right now on the planet. I'm almost positive. We have over 200 nurses just like that. That is amazing. Okay, REBAR nurses. Adeline, you got it. As needed. Katie, good job. Okay, we are moving on. What is the medication for gout arthritis? What is the medication for gouty arthritis? And do you guys know what is so funny? I see that you guys know these answers. What is the medication for gouty arthritis called? It is part of our pharmacology. Hey, the numbers are climbing. Share this video. We're doing a quick facts quiz. I want all of our nurses to know right now for Nurses Week, they can study with us all week. Tomorrow we have a tease review for all of our newly interested nurses. I've never done a tease review like this before. So we'll be doing math and we'll be doing science. So y'all pray for me, okay? Because the math for tease is no joke. Share this video. Don't be selfish. Hey, allopurinol. Yes. Good job, everybody. Oh my goodness. You guys are rocking it out. I love the comments. Latoya Gibson, you got it. Esther, I love that name. You got it as well. Okay, so listen, if you're in your car, if you're on your way to work, make sure that you listen to this because these questions, I'm going to start rapid firing them. And you need to know that you know this information. Okay, here we go. Next question. When is the best time to take a proton pump inhibitor? When is the best time to take a proton pump inhibitor? And think about this. Think about what is a proton pump inhibitor doing? What is it doing for your patient? And when is the best time for the patient to take that proton pump inhibitor? What do you guys say? Love it. Yes. Jaka. Is that how you say it? Jaka says before food. Absolutely. Before meals. Yes. Love it. Here we go. Next question. What do you call the high-pitched breathing sound? It's a squeaking sound that you hear. What is that called? High-pitched squeaking sound. All right. What is that called? Great job. The proton pump inhibitor, you do give that before meals. Absolutely. Great job. All right. The numbers are climbing. I want to see if we can get to 500 nurses. If we can get to 500 nurses for the quick facts quiz, man, y'all just made my day. That would be an amazing Friday. All right. We are climbing. I want everybody to answer these questions. It actually is wheezing. And so during the lung sound section of quick facts, if you have this book, you got money. This is like having money in your hands because this book gives you knowledge for you to be able to pass your NCLEX exam, increase your financial worth because you have a nursing license. Nothing better than that. All right. Who said wheezing? Wheezing on the screen. Okay. Good job, Kamal. Yeah. All right. Here we go. Next question. What is hardening of the arteries called? What is hardening of the arteries called? First answer on the screen here. Team REBAR, the first person that writes this out and spells it correctly, they should get a prize. All right. And just message them. I don't know. Let's see. The hardening of the arteries. Oh man, so many people got. Team REBAR, tell me who got that one first from Facebook or YouTube. It looks like the answer is arteriosclerosis. The answer is arteriosclerosis. And we're going to have to confirm it. A lot of people got that right. I'm seeing, it looks like YouTube first. Destiny Predestin. Did you get that one right? I think she did. Message Team REBAR, screenshot your answer and message Team REBAR. I think you get a cash prize for that. Next question is this. What is the lowest score on the Glasgow Coma Scale? What is the lowest score on the Glasgow Coma Scale? All right, good job, guys. The lowest score, right? Remember Glasgow Coma, there's a range that you can get. And this tells you how bad a person's or what level of consciousness a person has. So the lowest score is a 3. The lowest score is a 3. Hey, how many of you are interested in going back to school? How many of you already have your ADN, right? You already have your ADN, but you're trying to get your BSN, or you want to go back to school like I did and get that master's degree. How many of you on here want to do that? If it's you, say me. Just type in the comments me. Eva says me. If you want to go back to school, just say me, because I'm about to give you guys some information of how you can do that this week. How you can do that this week. And so part of Nurses Week is making sure that you're really investing into yourself as a nurse. It's a lifestyle. Nursing is a lifestyle. And so you have to be able to support it with amazing opportunities. So I have an amazing opportunity that's coming up in just a moment. All right. Couple more questions. Here is the next question. Lots of me's. Yeah. All right. Next question is this. What are some common side effects of giving an ACE inhibitor? What are some common side effects? There's one that you typically see the most when you're talking about an ACE inhibitor. What is that side effect? The common side effect. The discount code for the virtual trainer is going to be REBAR Nurse. The discount code for you guys who are purchasing your virtual trainer is going to be REBAR Nurse. And I just did that because Anna Jana said, what's the discount code? There it is. All right. Put that in and that will drop the price. Plus you get free shipping all this week. Can you go back to school? Can you go back to school for your master's when you haven't passed your NCLEX exam? I think that's a yes, but we can ask Lauren. I think so, because I don't think you need to, your nursing license allows you to practice clinically. But if you don't have your nursing license, there are still positions that you may be able to get without your clinical license. So I'm, don't quote me on this, but you may be able to do a research position. You're just not going to be able to pass medications, do treatments and things like that. But I still think that you would be able to continue on to your BSN, right? Your MSN, your PhD. Okay, but we can check. We can definitely check. All right. Matter of fact, I'm going to bring Lauren on because I see her there. She looks ready. I'm ready. You guys are ready. There were lots of me's in the comments. So let's bring on our guest. Everybody say, hey, Lauren, how are you?
Hello, everybody. I saw all those me's in the chat.
I know. Definitely.
Like, me too.
Yeah. So we are definitely going to have them to connect with you today. This is a great time to do it. We'll get them signed up. So anyways, before I do all the talking, hey, Lauren, just tell everybody who may be new to REBAR, who maybe their first time and they don't know that you are a very special guest. Just tell them who you are and where you're from.
Sure, absolutely. Thank you so much. So my name is Lauren Hazeltine, and I am with Grand Canyon University. I'm a university development counselor. I am centrally located here in Central Florida. However, I do support nurses throughout the entire country. And then we also have another counselor that supports students that may even be outside of the country. So regardless of where you are located, there is definitely support available for you through Grand Canyon University, through myself and Natty.
So Lauren, Grand Canyon University offers REBAR nurses a chance to go back to school. What kind of programs are available to nurses watching right now?
Sure. So we do have the RN to BSN. Okay. We have the MSN. We have a fast-tracked MSN as well. We have NP programs as well as DNP. And then we've also launched initial licensure and LPN to BSN programs. So it really has a very wide span for those that are interested in furthering their education. And even if you may know somebody that's like, well, I'm not so interested in nurses, also remember GCU has over 200 programs available online.
You know what? I like the idea of going back to school with a buddy, honestly. Yeah. It definitely is something that I think will give you even more support. But what I really like about Grand Canyon, even if you don't choose to have your own buddy, you can be the student's buddy. because I'm telling you guys, I've spent a lot of time with Lauren, and she really cares about making sure that your goals are met. Even if you don't choose to go back to school right now with Grand Canyon University, talk to Lauren, because she can help you develop a plan that makes it more realistic for you. So sometimes, Lauren, students will say, I want to go back to school. I want to go back to school, but they have a hard time taking that first step. What would you say to them?
So the first step is the hardest. It's the hardest for everybody. It doesn't matter what it is. School, riding a bike, the first step is always the hardest.
Yep.
The great thing that you have, though, is an educational partner with REBAR, and that's Grand Canyon University, and we're here. And it really depends on what your end goal is. And although, of course, I'm a huge proponent of Grand Canyon University and a little biased, the ultimate thing is really reviewing your options and what your goals are and ensuring that Grand Canyon University is going to be the best fit for you. A lot of times it is. There are some times that it's not. And I have been in the education industry for over 20 years now. And there are some times that I have to say, you know, I think we have to kind of look at all of your options and really see what's best and really see, you know, maybe it makes more sense to go back to that initial school because you only have 3 classes left. Where if you come to GCU, you may have 9. So let's really look at what is the best option for you. But the first step really to learn what those options and opportunities are is to reach out. So reach out to me, reach out to Natty. And the most important thing to ensure that you do secure the REBAR Nurse Scholarship is to reach out to us directly. So if you don't go to the website, unfortunately, sometimes we're a little lost in getting you navigated back over to the correct department. So that honestly is the number one thing, is to reach out directly to us. Yeah.
And we created a web page, just really quickly, that will direct you right to Lauren. If you go to rebarnurse.com/GCU, and that stands for Grand Canyon University. Keep that name in your mind. That's the school you want to be at. And then also, Lauren, you know, I just wanted to thank you for taking care of the REBAR nurses. It's phenomenal that they actually have an opportunity to get a scholarship just for being a REBAR nurse. So can you just tell them quickly about, you know, how that will work? What's the process like once they go here, right? Because everybody will be going here. Let me see if I can spotlight this really quickly. This is the website that I want you to go to, rebarnurse.com/GCU, and you will meet Lauren. Can you tell them just the steps about, you know, why you guys are offering a REBAR Nurse Scholarship and how you'll make it easy?
Sure. So, you know, it's just another way that Grand Canyon University gives back. We like to see every single student receive a scholarship. And the great thing is that you're not in competition with any of your peers. So it's an automatic scholarship due to the partnership that Grand Canyon University and REBAR has established. So it's automatic. So if you do decide that Grand Canyon University is where you would like to go, it's as simple as you receive a 1-page form in your student portal. You read it over, make sure you're okay with it. There isn't anything crazy in there. And then you check the box and you submit it, and then the scholarship is applied.
Perfect. And then Lauren, just one more thing. I see the nurses asking these questions. Number one, is it online? Is the program online, or do they have to come to a class, a physical class?
Sure. So for the RN to BSN and the MSN and the DNP, 100% online. For the NP, there are a couple times that you do have to go to campus for very short visits.
For the nurse practitioner.
Right, for the nurse practitioner for residency. And they actually do a very intense, something very similar to what Regina provides. It goes over the examination for NP. So they make sure that you are equipped with the knowledge and skill sets to be prepared for that exam. And then the other one, which is if it's initial licensure or LPN to BSN. So for those programs, we do an evaluation, we see where you are, and then there's a few different tracks. And then you do a lot of the coursework online up front. And then once you complete that, then there is an opportunity to go to a campus, and we'll look at those options because there's a few different routes. So for the majority of our programs, yes, 100% online.
And I think this is a good opportunity for you guys. If you have questions, you know, if you're an international nurse, if you need to know how long is the program, how much the program costs, reach out to Lauren, because she can answer your questions in probably about a couple minutes, and you will have a plan of what you need to do for your educational goals, your educational goals. Thank you so much, Lauren. Lauren will actually be joining us for the Nurse Success Summit again that we will be having next Wednesday. And we're going to talk about transitioning to actual nursing clinical practice, right? So it's going to be a great summit. We're going to talk about how to be a successful nurse, how education is so important to that goal. So we will be seeing Lauren again. But right now, if you are interested in connecting with Lauren before the big rush of people, because I'm telling you, it will be a rush of people, contact her now. Go to remarnurse.com/GCU and write out your information. It's really important for Lauren to have that information written down so she can connect with you. Okay? All right. Thank you so much, Lauren.
Thank you so much, and good luck to you all. And I look forward to hearing from you guys. Have a great day.
Bye. Okay, guys, we are getting back into it. I love our educational partner. I really do. I love Grand Canyon University. They're an amazing school. And the Remar Nurse Scholarship, how cool is that? Seriously, have you ever gotten a scholarship just for being part of a community? Woo. All right, here we go. Now we are getting back into our quick facts quiz. We are talking quick facts today. And so the last question that I asked was this. It was, what are common side effects of ACE inhibitors? And I saw you guys putting down that cough. That is what I was looking for. The laryngeal edema. ACE inhibitors are going to be known for that. They're notorious for that cough. Okay, next question is this. What bacteria causes gastric ulcers? What bacteria causes gastric ulcers? Lots of comments on the screen. It took me a while to get through these questions, but I figured them out. I sat down with my quick facts and I just pulled out questions for you guys. So what bacteria causes gastric ulcers? Good job, Janet. Janet says H. pylori, of course. Moving on. Next question is this. What is the best position for a client in shock? What is the best position for a client in shock? And think about all the different positions. Is it lateral? Is it dorsal recumbent? Is it prone? Is it supine? What is the best position for a patient in shock? You are rocking with remarnurse.com, and this is our Quick Facts NCLEX review. This is our kickoff event, and this is part of our Nurses Week schedule. So many great things we have. Share this knowledge. Right now, this is the 12 o'clock hour. So we're doing kickoff events. Actually, the correct answer, I don't see it yet. Oh, no, I did see it. Chantel, Trendelenburg. It's Trendelenburg. And remember, with Trendelenburg, your head is down. So you're kind of like this, an angle like that. And your head is down. And that means all the innervation in the blood, they're going to the most important organs, which are your brain and your heart and your lungs, right? So Trendelenburg position. Next question is this. What is the diet for celiac disease? What is the best diet for celiac disease? All right. Good job, Doris. You got it right. If you're driving in your car and you're listening to this, just say it out loud. Don't try to type it in the comments. All right. It's more important that you know it in your mind. All right. The best diet for celiac disease, gluten-free. Wow. You guys' comments are fast. I don't even know. I don't know if it's Facebook or YouTube first that's getting it. Okay. Here's another one. What was I thinking when I wrote this? Okay. What is the most common symptoms of Hirschsprung's disease? Hirschsprung's disease. What is the most common symptoms? You guys are like, what, Regina? What are you talking about? No, Hirschsprung's disease. It's a thing. Give me some common symptoms of it. You guys know what I'm talking about? Hirschsprung's disease. It's also called toxic megacolon. Let me see if anybody gets this one right. If nobody gets this one right, I'm going to throw this question out for future. You guys know Hirschsprung's disease. Don't front on me. Okay. No, maybe you don't know. Oh, no. You do know. This is what I have on my notes. Let me see. Let me spotlight the person that's with me. Yes, you're with me. Okay. It is. It's ribbon stool. It's ribbon stool. Okay. And Hirschsprung's disease, if you don't know, it's a condition that happens at birth, and you don't have enough nerves, right, in your large intestines. So it's you just don't have enough nerves. Okay, I'm moving on. Next question. What is the antidote for morphine overdose? What would you give for morphine overdose? What is the antidote for that? Morphine is an opioid. So that's what I want to say. All right. What is the antidote for morphine overdose? Are you guys with me? We're just putting comments on the screen. We're going over the quick facts book. We are getting ready for game night. Game night is on Tuesday. And with game night, remember, check the schedule. Okay. Set your time. Tuesday is game night. And game night, we play for money. Okay. And how you get that money, how you get that prize is the fastest comment. So I'm looking for fast comments today. Okay. The antidote, Narcan. I'm okay with Narcan in real life, but for NCLEX, you want to know naloxone. Okay. Naloxone. Here we go. This is a good one. What is the best indicator of dehydration? What is the best indicator that a person is dehydrated? This is what I put. I don't know if is anybody with me on this. The best indicator of dehydration is going to be weight. Weight. That's it. Weight. Next question. What is the best treatment for angina pectoris? What is the best treatment for angina pectoris? All right, guys, I am super excited. I love studying quick facts in general, but I love that today is the kickoff event. You're going to be hearing me say that a lot so you can let everybody else know that Nurses Week 2022 is going to be amazing. The best treatment for angina pectoris, guys, I want you to think of nitroglycerin, okay? Because although a person may be able to rest, I like that answer. Some people put rest. So although a person may be able to rest, we want to also give the cardiac system a vasodilator to open up. So nitroglycerin over rest. Okay. Next question. What is an abnormal accumulation of air in the pleural space called? What is an abnormal accumulation of air in the pleural space called? And we actually go over this in the virtual trainer too. But when a person gets air or fluid in their pleural space, what do we call it? Okay. Haiti in the house. Shout out to Ghana. I appreciate you being here. Philippines as well. It is like the middle of the night there. And you guys are here with us. Okay. It is called a pneumothorax. Okay. What is the diet for hypertension? What is the diet for hypertension? That's an easy one. Everybody better get this. I better have 100 comments right now. The diet for hypertension. But some of these questions may be a little bit easier because we have very new nursing students with us. And so they need to participate in this quiz too. We don't want our new nurses to feel like they can't participate in the conversation. They can't win a prize. Low sodium diet, not no sodium diet. I do hear people saying that all the time, like no salt, but that's just not possible. That's not possible, especially in an American diet, because we cook with salt. All right. What medication, let me say this. What pain medication is associated with liver failure and hepatotoxicity? What pain medication is associated with liver failure and hepatotoxicity? Hey, let me show you guys this. Tomorrow, we will be doing a tease reviews. Okay, a tease review Saturday night at 8 p.m. And we are going over part 1 of the tease subjects, which are math and science. Okay, this is going to be huge for me because tease is something that I get a lot of students asking me, hey, I know you do NCLEX, but do you do tease? So we will be doing a tease review. The pain medication that I was looking for that has hepatotoxicity and liver failure, yes, Raquel, I love that look on you, is definitely going to be acetaminophen. Okay, next question. What is the most common auditory side effect of aspirin? Yep, that was a mouthful. But the most common auditory side effect of aspirin, what is that going to be? When we talk about auditory, we're talking about how it affects the ears. So what would that be? The patient takes a lot of aspirin, then what they are going to report is, good job, everybody. You guys are doing so well today. It's going to be tinnitus. Tinnitus. Good job. Okay. No, tinnitus. Close. I can see why you might think that, but it is definitely tinnitus. It's tinnitus. Okay. Oh, this is good. When is the best time to take an antihistamine? In the back of Quick Facts, if you don't have this book, in the back of Quick Facts is this section called pharmacology, okay? Pharmacology section. And with the pharmacology, we go over different types of medications in alphabetical order. So under the allergies medication, you are going to read about this, okay? And so the best time to take an antihistamine, which is an allergy medication. Oh, some people, is it daytime or is it nighttime? Is it daytime or is it nighttime? Oh, I'm glad I asked this because there's some controversy on this. Oh, good. Okay, the best time to take an antihistamine is at night. And remember, most allergy medicines, they'll be like 24 hours. So if you take it at night and you sleep, it allows the medication to be circulating through your bloodstream by the time that you wake up in the morning. And when you wake up in the morning, that is when you want to have allergy medications if you got really bad allergies, right? Okay, so the correct answer was at bedtime, at nighttime. All right, here we go. Next question is this. What is the position that we put a patient in after a liver biopsy? What's the position after a liver biopsy? Not before a liver biopsy or during a liver biopsy. And they're not the same. They're not the same. So the position after the liver biopsy is what position? Hey, we are almost at 300 nurses. I'm humbled. I really am. I'm really humbled right now because it's a Friday and it's the Friday before Mother's Day. So I know people are busy. So you guys that are making this a priority, even if you're just listening to this and putting comments in every now and then, that's awesome. You really are. You are really doing yourself a great service. Okay, so the position after a liver biopsy is the right side, okay? Because remember, the liver is on what side of the body? Is the liver on the left or the right? The liver is on the right. So after, people are like, so why would you want to put it after? So after, yes, after, and you guys are helping me teach this thing. Help me teach this thing. After, you want to put pressure on the liver because you just cut the liver, right? When you did a biopsy of it, you took a piece of the liver out, and the liver, it bleeds a lot. It's very vascular. If you ever see a liver, you can tell that it's going to bleed if you cut it. So you put pressure on the liver afterwards, and it helps prevent hemorrhaging. Yes, good job. All right, y'all teaching this thing today for me. I appreciate it. Okay, what is the universal donor type for blood? I'm talking blood here. Universal donor type. And I want you to be specific. Let me see what you guys have. Comments on the screen. I want to see 1 million comments on this video because you guys are just commenting. Okay, now look, this is I knew you guys were going to do this. I knew you guys were going to do this. You were going to say O. But I want you to tell me, is it O positive or O negative? I want y'all to be specific because that's where NCLEX gets you. NCLEX knows you're going to say it's O. But they want to know, is it O positive or O negative? Oh, and this is where we split up as a community. I want to know O positive or no O negative. It's a simple question, but it is yielding all different types of answers. Oh my. Okay. The correct answer, I'm glad I asked this one too. The correct answer for the universal donor is O negative. It's O negative. Okay. I almost got that one. All right. Next question is this. What is the abbreviation OU standing for? The abbreviation OU, what does that stand for? What does the abbreviation OU stand for? Okay. OU. Somebody put that on the screen and tell me what OU stands for. Go ahead and tag your favorite study buddy because we have a lot more questions to go. So those of you who are just joining us, we've been studying for a while, but we have some more information to review. OU stands for both eyes. Good job. Good job. Tag your friends and let them know this is what I'm doing. This is the first day of Nurses Week. This is it right here. How are you celebrating your career? How are you celebrating your ministry? Well, right now I'm studying with over 300 nursing. What do we call ourselves? We should call ourselves nursing enthusiasts right now. Okay. What medication is used to induce labor? What medication is used to induce labor? Put that on the screen. We have a whole slew of things we will be doing for Nurses Week. So if you are interested in joining us, we have the Tease review. Sunday, we will be doing a prize giveaway on Instagram, and that's Mother's Day. And I'm just going to tell y'all right now, y'all need to be on that Instagram live. That's all I'm going to say. Monday motivation is happening. Okay. Also, my Tease review is going to be happening too again. Tuesday, we have game night. Wednesday, we have our Winning Wednesday, and we also have our Nurse Success Summit with Grand Canyon University. They will be signing more students up for school on that day. And then Thursday, we will be having an amazing International Nurses Day. So if you're international nurses, if you're an international nurse, we have a special presentation for you. And even if you aren't an international nurse, come on and study NCLEX with us as well. So if you sign up for this, you will get access to the workbooks for all of the events. So please go to remarnurse.com/Nurses Week, and you will get the workbook for the Tease, the Nurse Success Summit, the International Nurses Day. All right. You have to take part in this because we're going to be giving some amazing stuff away. Clothes, money, everything. All right. Okay, I asked the question. What was the question I asked? What medication is used to induce labor? And that is going to be oxytocin. Here is an anatomy question, very important. How many pair of spinal nerves do we have? How many pair of spinal nerves do we have? This is an anatomy throwback right now. How many pair of spinal nerves do we have? Somebody might need to Google that. I don't know. I don't know if we just have that information. All right. How many pair of spinal nerves do we have? Oh, man. Some people are putting 12 cranial nerves. Is that the same thing as a spinal nerve? That's interesting. There's two answers here. How many? Hey, so my research yielded 31. My research yielded 31. So 31 pairs of spinal nerves. So let me know if you have something else you'd like to present. But I think that's the correct answer. Okay, next question is this. Is lower airway obstruction a reason for a tracheostomy? If a client has lower airway obstruction, is that a reason for a tracheostomy? What do you guys say? We are studying quick facts for NCLEX. If you find yourself getting most of these questions wrong, that's all right. That just means you need to just study a little bit more from here. If you find yourself getting most of these questions correct, then good job. Good job. You are still in a great position. All right. The correct answer is going to be no. Remember, tracheostomy, is it for the lower airway or is it for the upper airway, right? Tracheostomy is going to be for your upper airway. So you get the incision, you can suction it out, right? But if it's a lower airway issue, tracheostomy is not going to help. All right. Tracheostomy is not going to help. Good job. Yeah. Okay. It was a tricky question. Here's another one. Is weight gain, here we go. Is weight gain a sign of active tuberculosis infection? Is weight gain a sign of active tuberculosis infection? What say it, you guys? It's all right if you're at work, Leah. It's okay. Don't let them know that you're studying with me. All right, just act normal. You got your AirPods in. You got to have probably the one AirPod in. I don't know. Do they allow you to do that at work? I'm not sure. Is weight gain an active sign of tuberculosis infection? Some people say no. Some people say yes. The correct answer, if a client has active tuberculosis, I wouldn't expect them to have weight gain. I would expect them to have what? I would expect them to have weight loss. Yeah, weight loss. Okay. All right. Next question is this. What kind of bag? You guys are really doing good. Seriously. We've been studying for almost an hour. I got to keep going though. What kind of bag does a partial rebreather mask have attached to it? What kind of bag? And think about what I'm talking about. I'm talking about a partial rebreather mask. What kind of bag does it have attached to it? What Leah said. Leah says, I'm a school nurse and kids are coming in, so I'm making a lot of mistakes answering. Okay, that's all right. Listen, I appreciate you trying. How is it being a school nurse? Do you love it? Do you love it? Is it busier than most people think? I think when I think of school nurses, I think you guys do screenings, and then if a child has like a stomach ache or something like that, then they come and see you, and then you call the parents, and then they go home. Do you find yourself dealing with other kinds of issues a lot? Let me know, Leah. I want to know. I want to be nosy about what it's like in a day in the life of a school nurse. Is anybody else? Somebody might want to be a school nurse too. Matthew, good job. Matthew Daniel is correct. It's a reservoir bag. It's a reservoir bag that the partial rebreather mask. And listen, the partial rebreather mask, this is going to be important because there's some things about it. Let me see if I can. Oh, Coco Melon, where is it now? If only I had written this book, then I would know where everything was. All right, here we go. I know it's in here somewhere, and I want to read it to you. It's very important. Just bear with me. Okay, oxygen delivery systems. Okay, so the partial rebreather mask, it looks like a regular face mask, but there is a reservoir bag attached to it. Now, this is very important. The question is, the reservoir bag, when should it be inflated? And it should be inflated at all times, okay? So if you need to study oxygen delivery systems, please look for it in here, okay? All right, here we go. Next question is this. What is the number one cause of acute pancreatitis? What is the number one cause of acute pancreatitis? Yes. All right. The number one cause of acute pancreatitis. And listen, guys, I want you to sign up for Nurses Week if you have not done so, because we are dropping the workbook for Nurses Week on tonight. Okay. What did Leah say? Leah got back to us. Don't you love it when people get back to us? Love school nurse, but the teachers don't want to teach, sending the students to class for simple things that can be taken care of in class. Well, Leah, so you're saying medical issues could be taken care of in class? What could be taken care of in class? Let me know. I want to know the scoop. All right. The number one cause, yeah, Claire. The number one cause of acute pancreatitis is, Meg, you got it, is alcoholism. Yep. Correct. Okay. Next question is this. What is considered an elevated bilirubin level? What is considered an elevated bilirubin level? Do you know? When you're studying your laboratory values, you need to have bilirubin on there because it's very important, especially in what population? What population are you gonna hear for NCLEX, or NCLEX going to talk about having an elevated bilirubin? It's going to be the kids mostly, and mostly it's going to be kids born with jaundice, right? So they're going to ask, all right, levels higher than 12. Okay. Yeah. All right, here we go. You hold digoxin if the heart rate is less than what? You hold digoxin if the heart rate is less than what? Simple question. This is for the fundamentals for our new nurses in pharmacology. Hey, if you are trying to, a lot of us take nursing school for granted. We take our knowledge for nursing school for granted. There are many people that are trying to get into nursing school, and they need to take the T's. If you know them, let them know. Tomorrow we will be doing a T's review. All right, we'll be doing a T's review tomorrow. Less than 60. Thank you. Less than 60. All right. Okay, here's a question. A sunburn is considered which of the following? A sunburn, like the sun in the sky, when it burns your skin, is that considered a first degree, a second degree, or a third degree burn? We're talking about a sunburn. Is that considered a first degree, a second degree, or a third degree burn? And thank you, Deborah. Oh, wait, hold on. I missed the comment. Here it is. Deborah says 60 for adult, 100 for kids. Cool. Thank you. And we're talking about a sunburn. A sunburn. A lot of people are saying first degree. I see some people saying third degree. That would be a severe sunburn. I can't even imagine the sun burning you like that. If you were on Mars, it probably would for sure. The correct answer, though, is first degree. Okay. First degree for sunburn. If a client has an internal pacemaker, can they use a microwave? If a client has an internal pacemaker, can they use a microwave? That's real. That's a very real question that patients will ask. And nurses probably have to explain this all the time. Can they use a microwave? Household appliance. Can they use a microwave? This is our Quick Facts NCLEX review, kicking off our Nurses Week right here at remarnurse.com. And we are happy to be hosting your study session today. Thank you for joining me. My name is Regina Callion, and I am the #1 NCLEX instructor on this planet. And nobody can stop me, right? Because I love my nurses so much that I'm doing stuff like this. I'm having study sessions, and I'm asking you, yes, absolutely. They can use microwaves and other household appliances if you have an internal pacemaker. But yeah, no, I love you guys. I can't imagine 300 people showing up to study with me. Man, that's just so humbling right now. Okay, this is the question. If a nurse notices blood on a cast, what is the first thing she should do? Okay. If a nurse notices, she has a patient and she looks at the patient and she's like, oh, there's blood on this cast. Like maybe the blood is coming through, right? Like the blood is coming up through the cast. What's the first thing she should do? Oh, I want to see. When I wrote this down, I said, I don't know if somebody would get it. I'm looking for a specific answer. I see it. It is this. Where'd it go? The comments are coming in so fast, I can't even spotlight them. All right. Yvette, I saw your answer. I can't find it anymore. But Yvette says circle it. And that's what you should do. You should mark the area with the time and date, because you can see that blood coming through on the arm. And then if you go and call the doctor, he'll say, well, how big is it? And you'll say, well, hold on. And then if you go back to the cast, it may have gotten bigger and now it's really bad, or, it may not have changed, but you're just not sure. So circle it, circle it, circle it, circle it. That's the best thing you should do. The nurse is not able to remove the cast. We don't have the ability to do that, but we can let the doctor know for sure. All right. Next question is this. What is the best location to take a capillary blood glucose finger stick? So if your patient needs to get their blood glucose checked and you need to do it, you're going to say, give me your hand. And then what is the best location to do that finger stick? This one, this one, this one, this one, this one, this one. Which one are you going to do? This is teaching, because we have to teach nurses aides information. We have to teach nursing students information. Ooh, there's a number finger that's best. Anybody know? Oh, absolutely. I would definitely say the side of the finger. Definitely the non-dominant hand, because NCLEX is going to want you to be so specific. Side of the finger on the non-dominant hand, but it's the third or the fourth finger. Third or the fourth finger on the non-dominant hand. All right, I'm moving on. Will corticosteroids increase or delay wound healing? Will corticosteroids increase or delay wound healing? Corticosteroids. What are we talking about? What do they do? And are they going to help increase and improve wound healing, or will they help delay wound healing? And it's good to know the answer, but also think about why. That would be the case. So the correct answer is delay wound healing. Good job. But why is that the case? Why does that happen? And so if you're not sure, make sure that you look it up today so you can talk about it intelligently. All right. This is another question from Quick Facts. If a patient has a duodenal ulcer, will there be pain on a full or empty stomach? If a patient has a duodenal ulcer, will there be pain on a full or empty stomach? And I was just reading about this earlier, and there was a chart. Y'all know what I want to say. I can't find it now. Okay. There's a chart in here that talks about duodenal and gastric ulcers. Let me find it. Here it is. Okay. It's under peptic ulcers on page 49. And if you study this, you'll see that the duodenal ulcer, the question is, when does pain occur? For duodenal ulcer is going to be on an empty stomach. Okay. So when a patient has an empty stomach, thank you, Kendra. Thank you so much. Kendra Jones, she said she got it. She got it for me on page 49. And then with a gastric ulcer, because you want to know the difference between duodenal and gastric ulcers, because they present differently. And so it's going to be pain with meals for the gastric ulcer, and then on an empty stomach for the duodenal ulcer. Okay, thank you. All right, that's it, guys. I got just two more questions. I don't want to hold you long. I know you have so much to do. So number one, actually it's not number one. It's actually question number 49. Clients with Parkinson's disease have a decreased amount of what? Clients with Parkinson's disease have a decreased amount of what? What do you guys say? It is the thing that is associated with Parkinson's disease. And I hope we find a cure for this soon, really. A lot of people are affected. And if they could just target, yes, Marcel, the dopamine. It's the dopamine. They have a decreased amount of dopamine. Yeah. All right, guys. Final question. It's a tough one. I want to know the first person that can get this one. It is this. What medication may be given for epiglottitis? What medication is from this book? What medication may be given for epiglottitis? I almost feel like you have to have the book to get this one right. Almost feel like you have to have the book. This is the final question for today. What may be given for epiglottitis? Hey, our school nurse came through. Shout out to Leah for giving us the inside scoop on school nursing today. Just a little bit. We might have to bring you on and you give us we want a full cover story on an expose on what it's like to be a school nurse. I want to know what it is. Okay, guys, thank you so much for attending. Hey, this was our kickoff event for Quick Facts. And this is all happening during Nurses Week. We have so much great stuff going on. Plus this, the virtual trainer is on sale, 20% off with the coupon code remarnurse.com. Plus free global shipping anywhere, Africa, Jamaica, Ghana, the Amazon jungle. The book will get to you for free during this week. So tomorrow, again, TEAS review for entry-level nursing students. There are 4 parts to the TEAS exam. There is math, science, English, and reading. And so we will be going over math and science tomorrow night. Is this how you want to spend your Saturday night? Absolutely. This is how you want to spend your Saturday night, preparing for your NCLEX exam and your TEAS exam too, first of all. Sunday is Mother's Day. We love our mothers around here. And so my mom and I will be going live on Instagram. She has no idea, but she will find out Saturday night. And we will be giving away something so amazing. You don't want to miss that. We have another TEAS review on Monday. We'll be doing reading and English, okay, on Monday. Then Tuesday, we have our game night. We love game night. We had like 1,000 nurses playing games. We were doing NCLEX questions. So I will be sending out the code for that on Tuesday. What else do we have? Winning Wednesday is coming up. Every single day of Nurses Week, we have something planned. And one of my favorites, okay, I'm doing a new event. It's the REBAR Nurse Success Summit. Okay. And at this event, we are going to be talking about how you can dominate your nursing career. It's okay to be a nurse and all, but I want you to be a great, amazing nurse. And so we'll have our educational sponsors, Grand Canyon University, there with us for that event. It's a nighttime event. So it starts at 8 p.m. And again, if you want to talk to Lauren now, if you don't want to wait until next week, but you want to get this taken care of, please go ahead and visit remarnurse.com/GCU. And Lauren is your counselor. Okay. So I'm handing you guys off to Lauren so that she can help get your paperwork started and processed. I don't want you to leave Nurses Week. And not have your education secure if you want to go back to school. Opportunities don't always come back around. And so this is a great opportunity for you to take care of that. And then the International Nurses Day event is happening on Thursday at 8 p.m. It's our final event. Okay. It's our final event. So definitely I want you to participate in that. And also I want you to have the workbook. So you need to sign up for it. If you haven't signed up for Nurses Week, it's super simple. Just go to remarnurse.com/Nurses Week. Okay. At /Nurses Week. All right, guys, I'm going to get out of here. The final answer was antibiotics. So thank you guys so much. If a person has epiglottitis, usually a child, then we would give them possibly antibiotics to help them. Okay. Well, it was a great event. Happy early Mother's Day. Oh, people have been asking about the REBAR clothes. So we definitely have the shirts available now for sale. We have mugs, we have totes. I bought a slew of stuff yesterday. So if you want the REBAR Nurse shirts, you can go to rebarnurse.com/merch. And I think we had 2 orders yesterday, and I was so shocked because I didn't even know how you found out that there was a rebarnurse.com/merch. All right. So that just shows how close you guys are into our community. Somebody leaked it, but it's officially out right now. So take advantage of it. Thank you guys. I will see you tomorrow. For our teas review. And remember, you can, you will, and you must pass NCLEX.